Hello, we've now finished Chapter 1 and will begin Chapter 2. Chapter 2 is divided into 3 sections, and we will examine the 40 series anterior teeth as well as the premolars and molars. The 40 series teeth contrast with the 20 series as they are on the mandible, not the maxilla, and on the right side, not the left. I chose this for the second chapter because focusing on the postural differences arising from these contrasts will provide many reference points for various ergonomic factors. I will begin with the 40 series incisor prep. Personally, I believe perpendicular alignment is more appropriate for this region than parallel alignment, so I will omit the parallel alignment. Let's get started. Alright, let's now examine the incisor prep for tooth number 42. The alignment will be in perpendicular R mode, with the suction tube hooked. In perpendicular R mode. We'll proceed with the assumption that the suction tube is hooked. Regarding the chair's position, the semi-supine mode is ideal. The chair should be mostly parallel to the floor, with its upper section tilted slightly towards the ceiling. Regarding the patient's head, positioning the headrest so their gaze is directed forward and upward, similar to this red arrow, and having them tuck their chin slightly, is beneficial for ensuring both visibility and accessibility. Now, operator's position. Align perpendicularly to the tooth axis at the 9 o'clock position. Keep your legs together with your right foot on the chair's pedal. As you can see in this video, push the doctor's table far enough in advance so it doesn't obstruct the operator at 9 o'clock. Push it all the way in first, like this. Also, ensure the handpiece line. Like this. Wrap it around your right shoulder or the upper part of your right arm to prevent the handpiece line from touching the patient's body. Maintain your back and neck within a normal range. However, to ensure clear visibility of the incisor prep area, a slight left lateral flexion of both the back and neck is necessary. Also, this. Right pinky. We'll rest on the anterior teeth in the 30s region, and by slightly extending the rest point of this finger, we aim for the additional effect of preventing the tongue from protruding beyond the tip of the 4th finger and going further. When dealing with the mandible, we'll examine the chair position and the headrest in more detail. The key is to adjust the chair and headrest so that the tooth axis of the mandibular anterior teeth and the operator's line of sight, this red arrow, are as close to parallel as possible. This is known as the semi-supine mode. The patient's upper torso is slightly tilted relative to their legs, creating a primary inclination, and then the patient's headrest provides a secondary tilt. Then, you have the patient lower their neck to create a third tilt. At this point, the positions of the upper jaw and the lower jaw are established, and this determines the specific angle of the tooth axis for the anterior teeth embedded in the mandible. By applying these various tilts, the tooth axis of the mandibular anterior teeth becomes as close to perpendicular to the ceiling as possible. When this vertical direction aligns with the operator's line of sight, the incisal portion of the mandibular anterior teeth will become naturally visible directly in front of the operator as they slightly lower their head. However, if these primary, secondary, and tertiary tilts are not applied, the operator would be compelled to laterally flex their neck to the right to the same degree of the tilt difference to gain an adequate field of vision. This action, unfortunately, places a significant burden on the musculoskeletal system. Alright now. Looking at the photo on the left, you can observe that the doctor's table is adequately moved to the back, ensuring it does not hinder the operator's 9 o'clock position. Similarly, coil the handpiece tubing around your right shoulder or upper right arm, so that this line does not make contact with the patient's body. Furthermore, when preparing the incisor prep, if you are resting your right 4th finger on the 30s anterior teeth, you shouldn't keep the finger rest point short as shown. Instead, extend it longer so that the 4th finger can advance deeper into the oral cavity, going beyond the incisor prep area of the 30s teeth. Therefore, this provides an additional benefit. It prevents the tongue from extending past this line specifically beyond the tip of the 4th finger, effectively keeping the tongue within that boundary. Now, Let's look at the prep for the buccal, mesial, and distal surfaces of tooth number 42. When performing an incisor prep from the buccal aspect, the natural bulk of the tooth inherently shields the tongue from the burr, making it convenient to simply hook the suction tube in the right corner of the mouth, rather than actively grasping it. The patient's head should be turned slightly to the left to ensure natural water flow, facilitating effective suction. Your left hand will hold the mirror, helping with retraction to get a clear view. Because of tooth number 42's nature, it is more appropriate to use a perpendicular R alignment for the incisor prep of the buccal distal corner. However, for the incisor prep of the buccal mesial corner, securing the view is not impossible if the patient's head is turned significantly to the right. However, it's actually more appropriate to approach it with perpendicular L alignment, not R, as this offers superior visibility and accessibility. Now, let's examine the prep of the lingual surface for tooth number 42. To achieve a direct view of the lingual surface without using a mirror, that is, a direct view rather than an indirect one, lateral flexion of the operator's neck is essential and cannot be avoided. Prolonged adoption of this posture can lead to strain on the musculoskeletal system of the neck. Therefore, it is important to assume this position only intermittently for short durations and avoid sustaining it for extended periods. We are now in grasping mode. In prior preparations, the suction tube was predominantly in hooking mode. The reason for the sudden shift to grasping mode in this video is to strategically place the bulk of the suction tube between the burr and the tongue to safeguard the tongue as shown. The left hand's fourth and fifth fingers rest near the zygoma, while the right hand's fourth finger rests on the mandibular anterior teeth. Now, during incisor prep on the lingual side of tooth number 42, there's often significant lateral flexion in the neck. To minimize this, incline the upper part of the chair and have the patient tilt their head down further. This adjustment will shift the entire tooth axis of the mandible from the yellow line to the green line, directing it more towards the ceiling. Because the lateral flexion is directly proportional to the overall tooth axis of the mandible, this action serves to lessen the amount of lateral flexion exerted on your neck. This means that by increasing the primary, secondary, and tertiary inclinations in the semi-supine mode, you can proportionally reduce the amount of stressful lateral flexion on the operator's neck.